right, so Bill's background is he's a chiropractor and he's familiar with nutrition response testing. He's a practitioner as well as a patient. In Bill's case, he had 2 heart attacks in the last 20 years. Most recently, you had one in 2017. And he has a stent to help constitute for the blood flow issues. Recently, he's complaining of sleep apnea. He says he tends to be dehydrated at times. He was put on Lipitor at one point to handle the underlying vascular issues concerning heart. And then in the last 7 days or so, his blood pressure was getting choppy and getting a little bit out of control. That caused him to go seek medical attention. He also had A-Fib 5 times since last November, and as early as last Friday night, which caused him again to run back to the hospital. And it calmed itself down, but then he was dealing with tachycardia at the same point. And he mentioned he's tired after eating. So these are the things that Bill is telling us he wants to work on. Now understand, doctors, that he's already doing nutrition response testing, so he's been evaluated with the traditional education that we've gotten and that we use. So what I'm going to do in live time, and not knowing what he's going to show us, is we're going to run the heart sound recorder and see if his body shows us he wants something in addition to what he's already been doing. Once we do that, I'll show you the results that came up, and then I'm going to show you how I would think on my feet clinically to help him fix this, and then we're going to actually work on him so you can see what happens as we go through this. So take a quick break. We'll be back in a few minutes. All right, so Courtney just ran his graph, and it literally took about 3 minutes. So now I don't know what it's going to show yet, but we're going to go take a look at it together. Okay, look what we come here. This is the story I told you. I can't believe it. I just told him Nadine's story. So now, guys, Bill, under good NRT care, and his care was excellent, comes in and he's missing a second heart sound right there. And what that is from a lack of calcium going from the blood into the muscle. Now, meanwhile, you're telling me that you're taking these calcium tests where they're looking inside the arteries to see that there's a prospective calcium buildup. Now, that could very well be true, but let's talk about the anatomy of what's going on in Bill's heart. So when one has a missing second sound, which is plain as day right here, and it's in his tricuspid valve, we know what valve it is, and we know what's missing right here. When this happens, patients will have heart pain. Won't have any idea why. They'll wake up at night and their heart's beating out of their chest and they're like, oh my God, I feel like I'm having a heart attack. But then they go to the hospital and they run enzymes and there's nothing wrong with the heart. You want to know why? Because there is nothing wrong with the heart, but you're not putting enough calcium in your heart muscle from your blood. This is a calcium transport problem, which is what Cataplex F fixes. So he has a Cataplex F deficiency, and the effect of that is a missing second heart sound. Now what that means in English also is that when the second heart sound is missing, that means when his heart's supposed to be closing, it's not closing. So you're constantly dribbling blood out of this valve because you're calcium deficient in the heart muscle. So that's our situation right now. And again, I didn't know what he was going to show us. This is an easy fix though, right? So we have Bill chewing Cataplex F right now. How many did you give him, Courtney?
4 Cataplex F and 4 Cataplex B.
Okay, so we're feeding the heart muscle the Cataplex B, and we're getting calcium from his blood into his heart muscle via Cataplex F. So he's going to sit for a couple of minutes. He's chewing. We're going to let him sit about 3 minutes. We're going to leave them again so he could chill out and relax a little bit. But you should be happy right now because we just found your problem.
Lack of calcium in the heart muscle, would that lead to A-Fib?
Absolutely. And the need for Cataplex B can also lead to A-Fib. So we're going to let him relax for a couple of minutes. We're going to leave the room, and we'll come back in a couple of minutes, guys. All right, so hang in there. Thank you. All right, so we just gave Bill the nutrition he needed to fix what we found. Let's see what happened. Okay, so we're going to look at his graph again. So let's go back. This is Bill after he just took Cataplex F. Notice how the tricuspid valve has restored. Go back to the earlier picture. This is how Bill walked in. A person with this graph is going to have heart pain, and if it's there too long, they'll have a heart attack. And this is Bill after chewing up Cataplex B and Cataplex F. You just fixed your heart. All right, so I wanted to show you this because I didn't know what Bill was going to show me, nor did Bill, right? Bill's got a hell of a history too. This is not an everyday history. This is a life-threatening history. Now, the point I try to make is that he's been under excellent care, and yet that was not being found. Now, does that mean that we no longer use NRT? Of course not. It means that we use NRT, but now we have an adjunct to NRT because now I'm going to do an NRT exam on him in front of you, and you're going to see whether or not we even have any weakness anymore, and we'll see if there's anything else we have to fix. Okay? All right, so Bill, let's get you on the table. All right. You're going to come lie down for me. I think you kind of know how this works, right, Bill? All right, so I'm just going to ask you to match my pressure. We're going to practice a little bit and calibrate you so you feel comfortable, very light touch, feel perfect. We're going to check him for blocking and switching. Standard testing, guys, nothing out of the ordinary. He's not blocked. Pinky and thumb together, open here. Touch your pinky and thumb on the left side. Great. So he's in healing mode. He's not blocked or switched, which means he can heal. Now, we just gave him something to make his heart work better, so I'd be highly shocked if his heart didn't pulse to a 12. But we're going to check everything else just to make sure we don't miss anything. Close your eyes, please. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So his heart's at a 12, right? We'll just go through our standard exam procedure to make sure that there's nothing else that's not being handled. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. His adrenals are at a 10 in body mode. Now, I want to do this with Bill. I'm putting him in mind mode. I want to know how his mind affects his body because I suspect with him that sometimes that's an issue. So now we're looking at what happens to his body when his mind is not at ease. Close your eyes. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Now the only thing I can't do right now is show you how he is when he has not had cataplex B and cataplex F, because he's had that. But for myself, I wanted to know what happens to his body when his mind is aggravated or engaged. Now, right now on the table, nothing is wrong with you. I have no weak reflexes in mind mode or body mode. So I wouldn't do anything with him except send him home on cataplex F and cataplex B. And whatever you've been doing with your practitioner, you do. Okay? Come on up. All right, guys, thanks a lot for your attention. I'll see you later on in the day, all right?